Our Are you right leaning?
I'm not really sure.
Smiling. That's really happy. Okay. Nice to see everyone. Hope you're doing well after your exam. One course down, a couple more to go. Great job. Okay. Okay, today's the year. It's a very relatively short lecture and a relatively short lab. It's sort of, you put your chisel in, you make a hit, and hope you got the lottery. And then move on. Yes?
Random question. How are we going to get our grades for the final?
How would you like?
Email.
Email. Thanks a lot. Not a chance in the world. Then what? Then they get hacked and they get put in Russian newspapers? I mean, really? Well, I had sort of planned on giving them back to anyone who showed up for Dr. Cusine's tooth extraction on the next day. Those of you who will not, gee, I guess you can wait till after Thanksgiving. Obviously, I'm not going to post them because that's not a nice thing. Actually, it could be great because everyone could get 100, but just in case. I don't know. I don't know. In a word, I will. Do you have any suggestions? Email. You want a personal email?
Can you not use CBase?
I'm sorry?
Can you not upload them to CBase? Like CBase, can you not upload them to there? Like our other tests get uploaded to there.
And on an individual basis?
Yeah. Well, no, that's how it works about county email. That's individually.
No.
And then added, right? Just see our grades.
Like
So,
when you log into your account, you can only see your own.
really? Well, I will try to figure out how to do that.
So
My facility with CBase is, shall we say, limited, but I'm always eager to learn.
you just hit grades and comments, and then you can go down, and so like, you just see all your grades.
Well, that's you can, but how do I get there?
I don't know.
So, what are you doing on the afternoon of the 22nd? Do you have to upload grades? No, I'll talk to Dr. Canella and all the powers that be and figure out some way of doing that.
If you take a list of people that know they're going to be here Tuesday, you don't have to upload theirs. It would save you more time.
Well, that's a big deal, but I'll my guess is I'll only know who's going to be here Tuesday when I show up Tuesday, but maybe not. Okay, well, if that's the way they do your other courses, obviously this can be done, and we'll figure it out. Well, I was going to talk about that tomorrow, but I will talk about that today. I would like you to bring the bone boxes in the day of the final exam. And in fact, that is part of the deal. In answer to your original question, Josh, when you get your grades, only after you've returned your bone boxes. So if nobody returns their bone boxes, I don't have to worry about giving out grades. If you do return your bone boxes, I'll try to get your grades to you. It sounds ugly, but it's amazing how the minute the final exam is over, people forget about all these bone boxes and everything else, and it doesn't matter anymore. So we have to play hardball on that one. So Danny will be in front of the lab when you come to take the lab exam, and he'll probably have a cart there, and he'll check them off. So the exam's going to be at 1, so feel free to come in anytime that morning. He should be available. But your grades will not be released until you've handed in your bone boxes. Okay? Okay, so as I was saying, today is ear day. This is a relatively short lecture, mainly emphasizing the structures that you will hopefully see during the course of today's section. Okay. So what's today's lecture about? We start with an overview of the different parts and regions of the ear, an external ear, and a middle ear, and an inner ear, and we'll go through them one by one and look at the individual parts, and then we'll talk a little bit about today's dissection. Okay, so as I suggested, the ear is divided basically into three parts. There's the outer ear, which is everything lateral to the tympanic membrane or the eardrum. And then there's a middle ear in here, and then there's the inner ear, which lies up against the cranial fossa. Okay, here it is in more schematic form. So the outer ear is all this stuff, which consists of the fleshy part that you see called the pinna, the external auditory canal, that thing that, you know, toothpicks go in, I mean toothpicks, hopefully not, Q-tips go in. Tympanic membrane is the medial end of it, and then there's the middle ear in here, which basically has three little bones and a few muscles attached. And this middle ear is also continuous by the eustachian tube with the nasopharynx. And then there's the inner ear here, which is where the nerves basically attach and is concerned with hearing and balance. So we'll start from the outside and work our way in. There's the ear, sometimes called the auricle or the pinna. It's got a cartilaginous structure beneath the skin. And all these little bumps and grooves actually have names. This outer loop here is known as the helix. The area opposite is known as the antihelix. This bump here, right next to the external tube, is called the tragus. And the area opposite it is called the antitragus over here. There's the earlobe or lobule, and then this sort of great big depression in here is referred to as the concha. Needless to say, these things can vary in size and shape among individuals. Okay, so the innervation of the outer ear comes from a variety of places, primarily the great auricular nerve and the auriculotemporal nerve. And blood to the ear, should you cut your ear and find it bleeds, comes from the superficial temporal artery and the posterior auricular artery. So blood coming from a variety of sources. And as you know, if you ever cut your ear, there's certainly it can bleed. Okay, so the external ear is, the next part is this area here that runs from the auricle outside, the outside world here, in through this tube that's partly cartilaginous, the outer 1/3, and then it's a bony tube further in, and it ends with the tympanic membrane or the eardrum. And as you are no doubt aware, the external part contains sebaceous glands that produce earwax. There's often hairs, bristly hairs around there, which help to keep some debris from getting into your ear. And then the internal part is bony. So there's actual bone in there. Innervation is sort of similar to the outer parts, mainly auriculotemporal nerve and the arterial supply, again, superficial temporal, venomaxillary, and posterior auricular arteries. Okay, so the medial end of the ear canal here is the tympanic membrane, which separates the external ear, the canal out here, from the middle ear on the inside. And that, you know, we call that the eardrum. It's obviously, it's protected by this canal, but if you poke things into your ear, it can be ruptured. Here is a close-up. So here's the tympanic membrane of the ear. And you'll see that the malleus, one of the little middle ear bones, one of the little ear ossicles, is attached to this tympanic membrane or eardrum. The reason for this is, as you'll see in a few minutes, and I'm sure you already know, is that the way you hear is that sounds from the outside world cause this thing to vibrate, and the little ear ossicles transfer the vibrations from the eardrum or tympanic membrane into the inner ear through a series of little levers and knobs that we'll look at in a minute. So the handle of the malleus is attached to the eardrum there, and the lateral process of the malleus lies up against this upper part. so that when the eardrum vibrates, picking up vibrations in the air, those vibrations are transferred through the other ossicles deeper into the ear region. The innervation of the tympanic membrane, which certainly has feelings. If you poke something into your ear, you can feel it when it hits the tympanic membrane. So the external surface is mostly auriculotemporal with little bits from other places, just like the ear tube. And the internal surface, is part of that tympanic plexus that we talked about when we reviewed the pathways of parts of the glossopharyngeum. Arterial supply, the external surface, again, is the same blood supply as the external acoustic meatus, and the internal surface is mostly tympanic branches of the posterior auricular and maxillary arteries. Same as the lining of the middle ear. Okay, so this area is the middle ear. It's a relatively small cavity, but it's filled by these three ear ossicles. The malleus, which is the one that's attached to the eardrum, the incus, where the malleus concludes with, and then the stapes, this thing that sort of looks like a stirrup for horseback riding, which lies up against one of the openings in the inner ear. So these things, the eardrum is attached to here, and so vibrations here pass from here, the malleus to the incus, and the incus to the stapes, which sort of pumps back and forth with the vibrations. Here's a prettier picture showing these things in place. So here's the eardrum or the tympanic membrane, the handle of the malleus. Okay, so the eardrum is not exactly flat; it's sort of concave from the side, and then the head of the handle of the malleus is in the back. The head of the malleus is this ball, right, sort of like a hammer, and it articulates with the incus here, and then we'll see in a few minutes the incus will articulate with the stapes. In these pictures, you can